If you think that every pain that goes down to your glutes or your leg is a herniated disc or sciatica, you're way behind. In this video, I'm going to show you how to find out if this pain comes from the cluneal nerve, the small nerve that many doctors or physical therapists barely even think about, but that can cause pain in your lower back, glutes, or leg. And the best part is that you don't need to be young, thin, or very flexible to be able to relieve this pain at home. This guy is crazy. These nerves are part of the cluneal nerve. I said cluneal. This nerve comes out from the lumbar spine and a little from the sacrum, goes along the side and passes through the pelvis to the buttocks. The problem is that this region here, this transition from the back to the pelvis, suffers a lot of tension from muscles and friction with the fascia. The result is that this nerve can be compressed, crushed, or stretched, which causes irritation in the nerve. The result is pain similar to what you feel with an inflamed sciatic nerve. It's no wonder that this pain is known as false sciatica. But there's an easy test for you to be sure if this is what's going on, if your nerve is irritated. You're going to use the pad of your thumb, following this bone here on the side, the hip bone, the iliac crest. Find the bone and follow it towards your back. It doesn't have to be exact, just about 3 finger widths from the spine. This is the region where the cluneal nerve passes, so you're going to look for the most sensitive spot and press it. If this spot, that cord-like band, triggers the pain you usually feel, it's confirmed. The pain comes from irritation of the cluneal nerve. I said cluneal. What an old joke. And to improve this nerve, we're going to start by doing a massage, a myofascial release, on this fascia that covers the entire spine and is probably the main source of irritation for the cluneal nerve. We're going to use this part of our hands here, okay? These little knuckles on your hands. Make fists with both hands and you're going to massage using these knuckles here. Look on the side of the spine. Always from top to bottom. Making strokes. Look, you can start closer to the spine. It's not on top of the spine, okay? It's on the sides. Do this a few times and gradually work your way farther out. We're going to do this massage here slowly. No rush, as far as you can reach for a minute. Back and forth. It's like you're making strokes. See, slowly. You're loosening up this fascia and improving circulation in the area. There's no rush. If you want, if you need to, you can stop to rest, okay? If you've done 30 seconds, 20 seconds, and you get tired, stop for a bit, rest, then come back to continue until you complete a minute. I'm shocked. Shocked.
My God.
In these 10 years on my YouTube channel, this is the first time I'm going to show this exercise. It's an adapted exercise that's simply perfect for this situation, because the muscles that irritate the cluneal nerve work together, and they work in a crossed pattern along the spine. It's the glute on one side and the lat muscle that goes to the opposite shoulder, just like when we're walking, for example, where the arms and legs work together. They work on opposite sides in an alternating pattern. So, the secret to improving the cluneal nerve is gentle stretching of these two muscles at the same time. The gluteus on the side of the pain and the shoulder, right? And the latissimus dorsi on the other side. Is that complicated? It seems complicated, but it's easy. Let's do it together, okay? You're going to cross the leg that's in pain. Do it like this. Try to relax your knee. If you can't cross it, just bring your foot forward, as if you were taking your knee to the other side, as far as you can, okay? But if you can cross your leg like this, that's ideal. Let your knee fall to the floor. The arm on the opposite side of the pain will cross over and rest on your shoulder. Now you're going to slowly bring your elbow toward your knee. It's not the knee that comes up. It's the elbow that goes down. Look. Go slowly until you feel a pleasant stretch across your back. Keep that good feeling without pain, the feeling of stretching. And keep your breathing relaxed. We're going to stay here for 30 seconds to 1 minute Then come back slowly, and yes, you can do the same thing on the other side. Slowly, without forcing it, keeping that nice and pleasant stretching sensation for 30 seconds to 1 minute. That made it even better. This sequence once a day is what you need to prevent the nerve from getting irritated again. And you can also use it whenever you need to relax your back. Relieve the pain on those rougher days. The next step is to strengthen the gluteus medius, the muscle that provides support and relieves the pelvis and the lumbar spine. I'll show you how to start this strengthening routine at home in this video right here. Just click here on the screen, and if your back feels looser, more relaxed, and more comfortable, give back by sharing this video with someone who needs it. Someone who feels lower back pain, has some kind of back problem, or sciatica that flares up from time to time. That's all I ask. Help this video reach and help the people who need it. I'll wrap up here. Big hug and see you next time.